heart health has become a very, very big deal, especially at the levels. We just crossed over some monumental lines, $3 feeder market, which many of us in this room, I know that have been incorporated in the market for a long time, never thought we'd see that kind of a level. And then we're seeing fat cattle over the 220 level. And so with $3,300 to $3,500 fats and yearlings bringing $2,500 or some more, the financial investment is it's huge. And so heart health and keeping these cattle alive is very, very, very important. Never has it been more important. I mean, always in every segment of the market for decades, keeping them alive is the most important thing, because they don't have the ability to do their job or make us our job or make us any money if we don't keep them alive. So we've got together a great panel of folks here this afternoon. I'm going to, incidentally, my name's Trent Stewart. Many of you on the panel I know, but it's nice to meet you. And I'd like each one of you to introduce yourself and let everybody in this room, as well as everybody that's watching online, make an introduction to them, if you would, please. I know we've got Joe Morgan and Grant Morgan with Poky Feeders. Randall Raymond is here as well. Paige is here as well. Randall, of course, is a veterinarian for Simplot. And Ms. Pratt, she works with Neogen. She's a doctor as well, a wealth of information. But if you go ahead and introduce yourselves, I would certainly appreciate it. Let's start with Joe.
Okay, my name is Joe Morgan, and I own Poky Feeders at Scott City, Kansas.
My name is Grant Morgan, and I run Poky Feeders in Scott City, Kansas.
Randall Raymond, work for Simplot Livestock as veterinarian in charge of our genetics, our research, animal health for all of the Simplot holdings.
Paige Pratt, I'm the beef genomics specialist for the U.S. and Canada for Neogen.
Thank you very, very much. I've got about, I'm going to introduce about 22 or 23 different questions to let everybody that's sitting in this room, as well as those that are online, get informed about this topic. But if you feel like you need to interject, if there's a question out there, we want to hear it too. There's no better time. You've got a wealth of information right here, and I think it's going to add significant value going forward. Please go ahead and make your questions known. But I'm going to start with the first question. I'm going to direct this towards Dr. Raymond. What do we currently understand about the root cause of bovine congestive heart failure, and has our understanding evolved in the past 5 years?
Thanks, Trent. Appreciate that introduction. So, congestive heart failure in cattle is something that I think we've recognized for a long time in the industry, mostly associated with altitude. And there's been several universities that have done a lot of great work helping us understand the pathophysiology of that condition at high elevation. What we know about the condition is that in cattle, they do not handle incidences where their oxygen tension is low. And when they have opportunities or challenges with oxygen, low oxygen, they go through a process where the blood vessels in their lungs will spasm and constrict as a compensatory mechanism to try and get more oxygen to the system. Once cattle do that, those vessels tend to stay constricted, and eventually they will scar and create a high pressure situation. And once that occurs, the side of the heart that is responsible for pumping blood to the lungs, it becomes overworked, and over time it becomes fatigued. It gets bigger and thicker, and then over time it gets so fatigued that it actually thins and fails. That's one of the mechanisms that's understood. There are probably lots of other mechanisms that we don't necessarily understand how it happens, but what has been, I think, revealing over the last 5 years, we've been starting to see this condition happen not just at high elevation but low elevation, particularly in the feedlot situation. We have cattle that are high growth and are really under some metabolic stress as they grow and as they put on a lot of fat. And so that's probably been the biggest thing we've learned over the last few years, is this is not necessarily just an elevation challenge. It's happening at anywhere from sea level to 2,000 feet all the way up to some of our higher elevation grass country at 7,000, 8,000, 9,000 feet. Most of the things that we've learned recently have come through surveying animals at the packing plant, cattle that have been on feed and are going through their normal harvest, and we're able to survey the changes in their heart and their lungs, and have been able to tie that back to some some genetic markers that have really helped us understand where and how we can improve this condition. And that's been probably the biggest thing we've learned over the last 5 years. It's very obviously heritable, one of the highest heritable traits that we can select for. And with using the right tools, we can impact cattle over the long term.
Thank you. Would Morgan like to chime in here, or did he cover most of it?
Well, he covered the doctoral part of it for sure. You know, of course, what we see, of course, is the death loss, and then having to explain that to a customer right before they go out that they lost a big fat steer. But I started noticing it probably 10 to 12 years ago in the feed yard. And at that time, of course, there was not that much known about it. We called it right side heart failure because we'd see the heart enlarged on the right-hand side when we did a post-mortem. But we did a lot of work back in those days, but didn't really know what we were really looking for. And so we've continued on that trail, and of course, these guys at Simplot have done a lot of work for us and for the industry to improve on this.
You know, please understand the gravity that's on this panel. Poky feeders feeding well over 100,000 cattle. Simplot Livestock at one time, the #1 capacity feed yard in the world, I believe could hold 120 or 125,000 at one time, still hosting over 100,000. So there are a lot of eyes on a lot of cattle. They're dealing with a lot of moving parts, and we appreciate your input. How is BCHF different from traditional respiratory or cardiovascular issues that we see in feedlot cattle?
I'm going to let the vet take this one.
Paige, jump in here. So traditionally, we've had high-risk animals in the first 30 days of the feeding period, and our respiratory risk tended to be in that time period. What we've seen over the last, I wouldn't say 15 or 20 years, is we've seen a shift in the death loss in our feeder cattle population shift from the first 30 days to the last 60 days. And the difference in congestive heart failure and respiratory disease is congestive heart failure is not responsive to really any of the drugs or any of the tools we have in our toolbox. We've tried lots of different things, but antibiotics are not effective. We've tried diuretics and we've tried steroids. None of those things change the outcome of the animal. The only opportunity we have to salvage them is to ship them ahead of their pen mates or ship them as we see them start to show clinical signs. Joe was mentioning a little bit earlier that they've done some of the same thing as we've done. One of our mitigation strategies is to identify those cattle in the pens. We've taught our pen riders to look for some specific clinical signs and ship them early. Those cattle typically do not get condemned. A lot of them grade high choice and prime if we ship them at the right endpoint. But the biggest thing is that they're not responsive to any of the medical therapies that we have available to us. I will say, though, respiratory disease and cardiac disease are very tightly wound together. The cardiovascular system and the pulmonary system work very closely together. So when we have challenges in one, we often have challenges in the other. And so as we think about tools, either for selection or tools for diagnostics, we have to think about both systems together. Paige, you want to add anything to that?
No, I think you hit the nail on the head on that one. Absolutely.
Since the doctors have the floor, are there any promising technologies, biomarkers, or scoring systems right now that are being used or on the horizon for early detection?
Sure. So because this is a heritable trait, we are able to select for animals that are more favorable for this trait back, before they ever get to the feedlot and the breeding decision. So I think that's where our cow-calf producers come in mind, our seedstock producers in our industry come in mind, is that we have the ability to be able to select animals that are more favorable for this trait. I always say, let's not throw the baby out with the bathwater. Let's continue making this high-quality product that the consumers are demanding and want and are willing to pay more for. But at the same time, within each breed, we have animals that are more favorable in terms of their genetic propensity to have a healthier heart. And so we are able, once we can identify those animals, and whether it be seed stock producers like myself selecting seed stock animals in our breeding programs that that are more heart healthy, and then being able to pass those advantages on to the commercial producers that are buying our bulls and being able to add those genetics into their operations. And so I think from a scoring standpoint, we have the ability to look at the molecular breeding value or an EPD of those animals to be able to find the more favorable ones within each breed and change the trajectory of our industry to be able to create more heart healthy animals. I listened at NCBA. Grant and Joe were on the Angus conversation with Mark and Kelly, and I thought it was so interesting when asked what is the number one challenge that we are facing moving forward in the feeding industry. And as a small seed stock producer, I could name some of our own, such as labor, regulations, whether it be limited supply in terms of number of head. But the thing that came out of their mouth was livability of cattle. We have to make sure these cattle are able to live, thrive, and not have a decrease in efficiency and productiveness throughout the entirety of their life. And I think that says a lot in regards to we've done really well at a lot of things that we have selected for using genetics. This is one thing, this is another tool to be able to add to our toolbox to improve the heart healthiness of our cattle.
The industry's changed quite a bit, and where we once were 30, 40 years ago locking a lot of yearling cattle up, now we're locking up a lot of cattle that are younger than that, lighter than that, getting the efficiency out of those cattle. Is there a certain age group that is more susceptible, or have you seen it at every age? Is it right before you ship them and they're pretty heavy, or do we see it in a more of an adolescent stage as well?
Yeah, good question. Can I add back to her question just a second? So we have a really robust tool to select for the genetic propensity for this condition. And there's been a lot of work done in that space. USDA published 4 markers almost 10 years ago that had some really high promise. And when we took that information and replicated it across many more animals, we were able to develop a test using, today our model is about 26,000 animals, and the genetic markers are very robust to predict genetic risk. But your question was about biomarkers, really, which is looking at things that are in the individual animal clinically. Those do not exist today. We've played around with a few things like sensor technology that detect motion and rumination. There is some real promise there. There is some opportunity, I think, to look for biomarkers where the heart is not functioning appropriately. We know those are available in some human cases and some human syndromes, but we do not currently have that in cattle. So what I think all that says is predicting the clinical outcome of individual animals is really challenging, and the genetic test that Neogen has and that's available in the industry doesn't do a great job of predicting individual animal risk, clinical risk, but it does do a decent job of predicting group level risk. And so as Neogen has come to us and some of the customers of Superior Livestock have come to us and said, we need ways to identify risk in groups of feeder cattle, we have models that do a reasonably good job of predicting risk at a group level. But the individual animal risk is a problem. It's something that we need to work on, need to understand more. Because at the end of the day, when the pen rider or the owner of those cattle is trying to identify cattle and understand what we can do to manage them, there's a huge opportunity there. It's something we need to work on. Sorry, you asked a different question. I had to go back. So
I was curious on ages, like that's more susceptible.
We see it more in calves. So, better quality yearlings, we don't see it as much. It's more on calf.
In the heart failure.
Correct.
Not an upper respiratory of any kind. I mean, I know that plays in too, but a lot of heart failure young.
Yeah. It'd be more on the calf side. Yeah.
Interesting.
We would see it in all ages. It's more visible in the late stage of the feeding period because there's less respiratory disease at that time period, so it's a little easier to not confuse those diagnoses or have diagnoses in the same cattle in the same pen, but we will see it at all ages.
Realistically, can genetic selection take place throughout the whole industry? Joe, I mean, do you see it to where in a market like this, as good as it is right now, do you think that when they're procuring cattle, can you realistically say, I'm only going to purchase these cattle because they're more genetically, immune to heart failure?
I think that's more important now than anyone. You're going to pay this much, because if you're going to pay this much, you have to have genetic performance. And back to what Doc talked about, I think is that like at Poky, for example, we grid all our cattle and have for years. And so we have tried to buy the cattle that work on the grid, of course. And what we have seen with these heart failures is that the high-performing cattle are more susceptible to it. So it is in the genetic selection somewhere. I don't understand it all, but we do see a higher prevalence of the disease in the higher-performing cattle. So that's been where our disappointment is that we have a customer that brings his, very best cattle, and then we have these issues at the very end of the feeding period. And so I do think it's genetic. I don't have any doubt, that it is. The industry's done a great job of selecting certain traits, to help. Look what we've done in the grading. I gave this recently in one of my speeches, but when U.S. premium beef started, for example, National's grade, and that would have been in the late 90s, the average grade the year we bought National was 49% choice. And last year they averaged 84% choice. So look what we've done in 25 years as an industry. So we have changed that immensely. And the industry should be very proud of that because we produced it. Look at the demand we have today for the price of these cattle. Beef is still the forerunner in protein on a plate, and we should be real proud of that. But with that genetic changes, we've got some problems that have come up like this. We have seen it in our business is that we've actually got areas of the country, isolated areas, that we see a higher prevalence of this. And to me, and I'm no veterinarian. In fact, they asked me to drop out of vet school when I was in college, and I know after listening to them, I know why they did. But we actually can see it that it's got to be genetic. So someplace in that community, there's a purebred breeder that has that in his herd, in my opinion, and he's sold his neighbor's bulls and this and that. And now we've got an area that they've got more prevalence of that problem.
So what's the best way to combat it? Well, we've chased EPDs for a long time. Myself as an auctioneer, I know that the representatives, when we're marketing cattle, we endorse certain EPDs. There's certain bloodlines I know that are more susceptible to it. But I know that people online or sitting in this room are like, okay, we understand that there's a problem. What's the best way to combat it then? And is it through testing your heifers?
So to Joe's point, marbling is a great example where we've shifted the marbling profile of the cattle population dramatically over the last 25, 30 years. We've done that because marbling is a heritable trait and we've put pressure on it. And so for some context, congestive heart failure is in the same ballpark for heritability as things like hot carcass weight and marbling. We can select for any trait that we have a heritability estimate on if we find the right populations and we focus and are disciplined on selecting lines that have or individuals that have that profile. The challenge is with this trait is not enough cattle have been tested, enough cattle have been screened. So it's for the most part unknown where the cattle are that are low risk, and it's unknown where the cattle are that are high risk. So I think the answer to the problem in the industry is to screen a lot of cattle. Screen a lot of cattle across lots of breeds. We are confident that there are high risk and low risk cattle in every population, and that within that high and low risk population, there are also cattle that have high performance, high marbling, high hot carcass weight, high average daily gain, favorable feed efficiency. So the answer is, as an industry, screen a lot of cattle. The reason we've been able to make progress in things like hot carcass weight and marbling is because we've had a lot of cattle with an accurate EPD that we've been able to use that tool and leverage it to select for them. And this is just new enough that there aren't enough cattle screened to know where the low risk ones are.
What feeding, implant, or environmental management strategies have shown promise in lowering the risk of severity for BCHF, and what impact do those strategies have on the bottom line? Environmental at home.
I would say none. Like Dr. Randall said, I mean, if we can identify those cattle early and get them out, it's probably been more of an issue on the late day cattle. The only thing that we've found is if we have a dead after terminal implant, we're 10 times more likely to have another one. So especially on these high powered cattle, we won't put them on a beta agonist or Experior. So monetarily that costs us a lot of money not to risk having another dead on those animals.
What's the percentage of death loss due to this in a large feeding operation? Like,
I mean,
both
from
of
our
you are
standpoint, it's tough to tell. It's been a problem for us for several years, so we've kind of went away from buying those high-powered calves. My dad, we've kind of made the decision to buy more of a, animals got more heterosis, crossed up a little bit, hybrid vigor in it. But on the several customers that we have those high-powered cattle in, I would say it's, probably around 2%.
Would that be about right?
Yeah, in our population, so our largest feed yard is feeding an average of 125,000 head, so it'll peak about 130,000. A little less than 1% of that feed yard population across all breeds and breed crosses will be a mortality due to congestive heart failure. If you look at certain subpopulations and high-risk groups of cattle, that could be as high as 5%. We've had some groups as high as 10% in a few individual lots. So it varies a lot based on cattle type and their genetic risk. But the 1% of 120,000 head, if you do the math on that, it's right at $3.5 million a year. It's not an insignificant cost.
No, the 1 or 2% doesn't sound big until you really put the dollars to work.
And to our Poky feeders point, it gets higher and higher, and towards the end of the feeding period, that becomes more of a challenge because of the cost we have in the cattle. And I think you can't overlook the emotional cost to the owners of the cattle and to these men and women that are responsible for taking care of these cattle. We've got very caring pen riders that we've trained, and they do a great job, and they truly care about these cattle. And it is absolutely demoralizing to them to know that they can't do really anything about this syndrome. Regardless, they can find them, they can get them gone, but it's a pretty challenging emotional challenge as well.
Well said. Yes, Mike.
Using left for high altitude cattle, were they selected for their bull power for fat force? Repeat the question.
I did usually tune Mike out, so would you no. He says are high altitude, like low pap cattle, less susceptible to heart failure?
Yeah, so it's a great question. So we've done more work on pap over time than anything else as far as trying to identify this syndrome. I'll just tell you a couple experiences that I've had this spring. So I've done a lot of work with Tim Holt at Colorado State. He's probably done more pap testing than anyone else in the world. Tim's called me probably 6 times this spring, and he said, I'm just leaving this ranch. We've been pap testing cattle here for 10 years. They've been selecting their low pap bulls to go back into their breeding system. And this year we have more high pap animals than we've ever had. And so, like I said earlier, we believe pap is one part and one pathway of this syndrome. The way I think about pap today is a high pap animal is showing clinical signs of heart failure. They've already gone through the process of constricting their pulmonary vessels. They've already gone through the process of scarring those vessels. They're already down the road in the right heart changes that happen because of a high pressure situation. But low pap animals don't tell us anything. Low pap animals about their genetic risk. Low pap animals mean they haven't started to show clinical signs for the syndrome. So in our world, pap doesn't mean that much because we don't know if they're high or low genetic risk, and we don't know what other stressors in that animal's life might trigger them to go down this path. So some of the cattle that struggle the most are animals that are high genetic risk for this condition that have been at altitude. They come, they come down to lower elevation to be on feed, And the altitude change that they've been experiencing has already changed their pulmonary system and their heart function, their heart structure. So now they come down to altitude, we put them on feed, and they become some of the highest risk animals we have. So it all depends on their genetic risk and what stressors they've been exposed to over their lifetime.
Well, along that line, what can the cow-calf sector play in helping mitigate BCHF, and what data needs to flow back upstream to prevent, to improve, and prevent some of this heart failure? Dr. Pratt?
Absolutely. So we are working with a lot of commercial cow-calf producers at this time, not only in identifying seed stock that are going to be able to carry the genetics for more favorable heart health, but also they are specifically interested in looking at both sides of the equation and selecting for replacement heifers that are more favorable for heart health. And so we are able to take an IGNT beef test on a heifer that would give them traits, other genomic information for marbling and stayability, growth traits, et cetera. And then we can add on a heart health BCHF score as well to be able to have them help them select females that are more favorable for heart health. And so I think the dual approach of selecting bulls that are more favorable at the same time we're selecting females. If you are, whether it be sticking with one breed or if you're trying to make improvement in the animals that you own, I think that's a really good strategy to be able to help you make selection decisions and move forward. And quite frankly, at this point, with calves being as high as they are, there is absolutely no need to keep any replacement heifer that isn't going to get the job done on all cylinders. And so if she's not going to stay in your cow herd and have longevity, if she's not going to produce pounds of calf, if she's not going to have some marbling and ring some bells and then have some heart health, then quite frankly, she needs to be a feeder heifer right now. And so that allows folks to be able to have an approach that allows them to consider heart health along with other factors that will make them ultimately more profitable as we potentially move into less favorable cattle markets.
As we've looked at our cow herd, one of our biggest eye openers is we've embedded this trait in the Simplot cow herd, which is about 30,000 cows in 4 states. And we've been doing that unknowingly because we've been selecting for cattle for high performance. And we know this trait is very highly tied to average daily gain and hot carcass weight. For the first time this year, we genetically tested every one of the Simplot replacement heifers. We AI about 4,500 heifers a year, and we're going to screen every female going forward, every bull purchase going forward as a way to try and move away from this trait. We're going to live with those females for 10 to 12 years if we're doing our job right. And so to Paige's point, they need to make sure that they are low risk for this plus favorable for all the other traits we care about.
Is this test affordable?
Absolutely. So the test as a standalone test, if you wanted to test a bull or just a female with no other traits, just a BCHF test, it's $18 in a standalone format per head. If you want to add it to an IGNT beef heifer test, or if you wanted to test a bull on IGNT beef to be able to get some of that information as well, it's an $8 add-on to a $30 genomic test that gives you 17 traits, 3 indexes, and parentage. So from if we look at it on a cost standpoint on what those cattle are worth that either have decreased performance, and I think that's something we can talk a little bit about, is this isn't just about cattle that have faced mortality. There's also some morbidity along these lines that decrease performance and efficiency in these cattle to make them less profitable for cow-calf as well as the feedlot sector. But if you divide out the cost of one of those dead animals, you can pay for quite a few tests to be able to ensure that what you're selecting for the future of your program is going to lead you in the right path. Because otherwise, we are selecting for these traits that are positively and strongly correlated to bovine congestive heart failure. We're increasing their appetites, making them be able to eat more, gain faster, and have bigger carcass weights. And if we don't check where we're at on BCHF and we just continue down this path, then my fear is that we will continue to see increased morbidity and mortality. and at what point are we going to tip that scale and make those really good genetic calves that we all want to produce, that these feeders want to feed? When do we tip that scale? And like, like Grant indicated, maybe that folks back off of those cattle just a bit because they don't have the assurance that they're going to be able to have livability and be able to survive in the feedlot and be more costly because of that.
Well, explain the superior cost. I think that's
The
important.
cost is what.
What
Yeah,
we lose by not feeding it.
So, I mean, to your point, I think we've already tipped over that point in our opinion. But so if we don't put cattle on a beta agonist or Superior, for example, versus not putting them on anything, at today's price is about $70 a head. That's what that value is. And so, at $2 fats, it's probably more like $48, but at $2.20, it's about $70 worth per head. Not putting them on, just the risk of not having any more deads on that set of cattle.
Putting them on what?
Superior, yeah.
Yeah, it kind of a question I wanted to direct because we're talking about cow-calf producers, and you can spend $10,000 on every bull for 10 years trying to improve a cow herd. Why wouldn't you dig in and evaluate those heifers? I mean, you jump ahead by light years as far as accuracy goes in your cattle, and that's directed towards cow-calf producers. But I know John and Heather, you take some responsibility for your customers. They're believing in you. Any seed stock producer in the United States that is successful, when they show up at your place, they don't maybe know the genetic background of every cow in the Angus breed in your circumstance, but they're trusting that you have a quality product and you've got the genetics and the genetic makeup, not only for performance and how they're going to perform on the rail, and so they're going to be a desirable, because you wouldn't have helped put this panel together.
Well, in our opinion, there's not a silver bullet. So it's not a fix that we're going to have today. We can't walk out and say, this is the fix, here we go. We've taken years to get here, so it's going to take years to fix it. It's going to take genetic cycle. We're not, in the pork and the chicken industry, we've got to go 9 months before that next calf hits the ground. So it's going to take time, but we've got to start. We've got to use the tools that are there, and we've got to start to fix it to help it for the end game. It's a total team effort to get it done.
Just to kind of go back to something that you guys talked about a bit ago that is stuck in my mind on this. You talked about high-risk cattle, so that we can clarify for maybe some of those that haven't been in the feeding industry that doesn't understand what that means. That means cattle that get sick, all right? So are you telling me that if you get a set of calves that you never have to treat for any kind of respiratory disease or anything like that, say they've had no shots whatsoever clear to the day to harvest, the mortality rate goes down to less than 1% in some instances, or cattle that have been treated for sickness, it could jump up as high as 15%. Did I understand that correctly? That it has a direct correlation with cattle that have been treated somewhere along their life?
Some of these animals have never been treated, to our knowledge, for anything, that are having challenges with congestive heart failure. Respiratory disease is one of the triggers that can cause this syndrome to kick off, but it's only one of many. Really, it's anything that causes a low oxygen availability for the cattle can trigger this syndrome. So altitude's one, obesity is one, high growth rates is one, heat stress is a huge one. So we see a peak of this every summer, and I think most of you probably feel the pain and remember the pain of the 10,000 or 15,000 head we lost in Kansas 3 years ago in that heat event. We see that happen every year. That one just happened to hit the news. We see it in the Northwest as well as we do in the South. So heat stress is a big one because it changes the way those cattle are able to oxygenate. So yeah, just to clarify, respiratory disease and cardiac disease can be synonymous, or one can affect the other. But in a lot of cases, these cattle that are dying of congestive heart failure have never had a respiratory treatment. Their lungs are completely clean. They don't have any previous lung consolidation or lung disease. So they can be completely independent, but we do know that respiratory disease challenged cattle also go through a scenario where they can't oxygenate as well, and that can trigger the syndrome as well. Does that answer your question?
Everything's market driven. So, Grant, you made a statement a few minutes ago saying you've kind of directed your procurement towards more heterosis, buying some crossbred calves. Is there a certain breed that you see it more prevalent in as cattle feeders?
Yes, the Angus breed.
And so you'd like to see a little bit more heterosis, I mean, in when you're making your procurement
From
decisions.
our standpoint, yes.
Interesting.
Well, you can have heterosis within a breed.
Yeah.
So, we're not picking on the Angus breed. I just think it's been a little bit, selective trait as we've done as an industry to move this grading and carcass weights. And another thing that we don't talk about is that as an industry, we're all making these cattle bigger and heavier. So this becomes more prevalent as these cattle get bigger. You're feeding them more days, and it's just like a human population. As they get older, you're going to have more death loss, and so that's what we're faced with. So it's just a kind of combination problem that's faced with the feed yard.
Hearts stayed about the same size, hot carcass weight quite a little bit bigger. Is that correct?
So that's a good question. So I've been doing some work with Ty Lawrence at West Texas A&M, and we've weighed quite a few organs and are looking. We have a current project going right now looking at that. And it's Ty's project, and I've collaborated with him a little bit with the CS beef packing plant and some of the cattle that came out of our system to identify what is the ratio between heart, lung, liver, and kidney size as relative to hot carcass weight. I don't know that we know the answer to that, Trent, but that's current work that's in process.
Thank you. Are you seeing a lot of transparency when it comes to genetic background to calves when you're buying them? I mean, they try to list the vaccines that they've got, but if there's some heart health issues, are they just as direct towards you, Joe?
Yeah, no.
I mean, quite honestly, I don't want to jump in front of them, but we have more of an issue with guys actually giving the vaccines when they're supposed to on the programs.
When they're not supposed to, is that what you say?
Yeah, or when they're
right.
So when they're
carrying too
supposed
much
to.
stress. Maybe.
yeah, we can go down a long list of that. But
Right. Yeah, timing is a big deal
Yeah.
when it comes to that.
I mean,
'cause it's
that's
all
one
about
thing
stress.
is as reps, so you guys really, and I've talked to Danny about this, but you guys really need to pressure your producer to follow the rules of VAC 34 and those kind of things. Because we've had several issues this last year where the calves we found out the calves weren't vaccinated when they're supposed to be. We didn't know about it. 5 days later, we're revaccinating the calves and we tip them over. It's a wreck. But I think overall, back to your question, is that, we don't want to pick on heterosis as a breed, but we have just found that we don't have as much problem with crossbred calves as we do with a straight Angus, high-performing, the very best black calves you can buy.
I like what you said about, heterosis within a breed. So just some outcross genetics. Spread some. If you're going to stay all Angus, make sure that there's some outcross to them.
Yes.
Okay. Is there some?
Breed color makes a difference. Have you seen any color difference?
Breed color is what he's getting after. Angus, black Angus, or red?
Yeah, we see a higher prevalence in the straight Angus calves. Yes.
Would any of that have to do with heat stress at all, like you talked about, being black-hided with more hair on them?
Yeah, hide color makes a huge difference, and so the dairy breeds tend to be lower risk for mortality, even if they have higher genetic risk, because they have thinner hides. And the lighter color you make them, the less heat stress they experience. So as it relates to heat stress, hide color makes a huge impact. Some of our higher risk genetic animals have red hides, but they die less in the feed yard, and I attribute that to hide color. A black hide draws a lot of solar radiation. Just to give you a little context for that, a few years ago we did a little evaluation of our feedlot pen floors, and in times of high heat stress, we will bed with the whitest, brightest wheat straw we can find. We can change the temperature of the pen floor by up to 20 degrees by bedding with wheat straw. So if you can kind of extrapolate that to the difference between a white hide and a black hide, or a red hide and a black hide, there's a big difference in how much solar radiation will be absorbed.
During the feeding period, how do you differentiate between heart failure and like a sudden death or respiratory distress in cattle, especially late in the feeding period?
Are you talking about it in the mortality?
Yeah.
Yeah. So a good necropsy is the way to differentiate any of those causes of mortality. So I think being disciplined and necropsying every possible animal and characterizing them appropriately is the right answer. A very uncomplicated congestive heart failure has some very characteristic changes in the right heart wall. So they're pretty obvious once you've seen a few of them. So we have modified our diagnosis categories over the last 5 years to capture heart failure that is associated with respiratory disease, associated with interstitial lesions, and associated with no respiratory lesions. So try to categorize them so that we can delineate where the mortality is coming. I don't know, are you guys doing the same thing, Joe?
Yeah, I mean, to a point, yeah.
As a clinical animal, it's really hard to tell some of those apart. So we've trained our pen riders that if they look abnormal, we call them fragiles. Remove them from the pen and we'll ship them early. And we've found that by doing that, and we have the luxury of owning part of a packing plant, it's only 40 miles from our feed yard. So that's a real luxury in allowing us to get some of those fragile cattle out and harvested. But around 35 to 40% of those animals that we identify as fragiles are true congestive heart failures, and the rest are some chronic respiratory lesions, the occasional renal failure, some really odd things that we would never be able to differentiate horseback. But we just identify they're struggling to breathe, they don't want to move, they're abnormal. And I guess I probably should say that. The biggest clinical sign we see on these animals in the feed yard is they just don't want to move. We call it exercise intolerance. You move them from here to the back of this room and they will quit, turn around, fight your horse. They just don't want to move. That motion runs them out of air and they just don't want to do it.
Directed at feed yards, this next question. We've talked about Grant noted Experior. What other, have you changed your ration at all? I mean, is it that makes them less or more susceptible in feeding cattle?
Well, years ago, before we really understood this as much as we do today, and we've still got a lot to learn, but we did go through times, and there is, I don't know if it's truly a correlation, but one of the things like Grant mentioned, we see it in Angus calves. Well, obviously, when do we buy most of our Angus calves? In the fall. And when are they fat? Now, going into summer and hot weather. So, there's probably some little correlation to that. But back to what I started to say is in the early days, we did back up the rations to a cooler ration and thought that would help, just not to challenge those cows so much. But we didn't really see a big advantage to it. We tried it for a few years and didn't really see a big advantage to it. But the bottom line is you do those things for a small percentage of the herd or the pen, and you're penalizing all the rest of the cattle, So all you're doing is trying to save yourself from another phone call to that customer, really.
And let's face it, the high grading cattle, like you said, we went from 50% to 83%. We're going to feed them a few more days, going to try to get the best genetics that we can. What's a prime worth today? $200 or is it more? Or less?
Yeah, $200.
Around $200 more. So there's plenty of incentive to buy the right genetics and get a lot of marble in the cattle. That's all part of the business role of feeding cattle. So we got to keep them alive.
Trent, just to clarify on some of the work we've done, we thought this would be a fat-related trait. We thought this would be highly associated with marbling and back fat. And so we went into it with that mindset. The data suggests very strongly that there's not a positive correlation between heart failure and the fat traits. There's a high positive correlation to hot carcass weight, average daily gain, and feed intake, but actually a pretty flat and almost a little bit negative correlation to marbling and back fat. So selecting for high marbling cattle is not the problem. Selecting for high growth cattle is where we've drugged this trait along.
More stress. That's very interesting. So it's a fact that we're getting the cattle big fast more than intermuscular fat, so to speak.
Yeah, I don't know that we understand why it's so tied to the growth traits. We just know that it is. So what we also know is that we can find high growth cattle that are low risk for this trait. The answer is screening lots of cattle, because once we find the populations that are low risk for congestive heart failure, we will also find those that are low risk and high growth. They exist. We found handfuls. We just need to screen more cattle to find a population that we can move forward with.
What practical advice would you give producers who are seeing higher than expected heart failure losses but aren't really sure where to start?
So I think the place to start really is genetics, right? We've said that this is a heritable trait, and being able to select for genetics that are going to help you improve this trait will be the first, and I think the most meaningful way to be able to move forward in a positive manner. And so I think, I mean, we've been picking pretty hard on one breed here, but I think again, we have the ability to be able to improve heart health within every breed. But we have to identify the good ones, as Dr. Raymond just mentioned. And so I think being able to utilize that information as you're selecting your bulls is extremely important. So I always encourage my customers, if you want something and we aren't providing it as a seed stock producer, ask us, tell us that's important to you. And so if you ask me and tell me it's important to you and I have enough time to be able to do something about it, then I'll make some changes at our place to be able to provide you that information. And so as you move forward and you want to be able to make sure that you are able to provide the highest quality genetic cattle of the breed that you think does all of the right things in regards to providing a high quality product for our consumers, you have to be able to find those cattle. So selecting bulls with good genetics for heart health in addition to other traits you're interested in, and then being able to possibly go forward and select some females that are good for a multitude of traits, with heart health being one of those. But for me, I think genetic selection, because it is a heritable trait, I think that is the first step personally, and that's honestly, it's the first step at our place that we've taken. We've tested our bulls, we've tested our replacement heifers. We're utilizing that tool to be able to select bulls that we're AIing to, where we're flushing to, and we've been able to utilize that in our selection practices to be able to improve that trait, along with continuing to hold the other traits where we want them to be, whether it be foot or claw or pap or whatever is important to you. We can find cattle that can do it all, but we can't if we don't have the information available.
So what's the easiest way to get that information? Spring bull sales, everyone's calving, they can barely afford the time to go to a sale. A lot of times they'll just try to buy them online. So as a seed stock producer, well, what do they need to do? What tools do they need to provide? I mean, because you go through the bulls, you find the most appealing bulls, they're structurally correct, maybe have an EPD profile that is acceptable, high accuracy cattle. How as an industry in the seed stock sector, what do we need to do to make it, easier for cow-calf producers on a commercial level?
So when I select bulls personally, I get down to the nitty gritty, and I get a spreadsheet of all the EPDs of those bulls. With 5 minutes or less on a computer, I can provide that for our buyers at the click of a mouse. BCHF molecular breeding value or score can be a piece of that information, and then I start sorting cattle to determine which ones are going to be in maybe the top 30% for the 7 traits that I desire at the highest level. So as you go into bull acquisition, or as you're looking at that for next year, if you've already made those decisions, the cattle are already turned out on grass, and you're thinking, well, I can't do anything now. The bulls are turned out or getting ready to be here in the next 20 days. I would say, if you have conversations right now with your seed stock providers, it allows them to put it on their radar to be able to start selecting their replacement heifers as they come off in the fall, and utilize that as a tool for them to be able to start making genetic improvement. And unless somebody comes to you and says this is important and you have some pull through, then it's hard to spend the money at any point in the industry. And so we have to be sure to have those conversations with our seed stock providers, that it's an important piece of the information we want to utilize, along with all of the other information that they provide us.
Thank you. Is there questions on the floor?
Thank you. What role do you believe branded or kind of value-added programs like Heart Healthy should play in marketing these feeder cattle? And do you ever see a future where animals with that genetic propensity for these diseases could potentially be receiving discounts?
I think the place is, this is a risk management strategy at the feeder level. And Joe and Grant, jump in here where you see this differently. But when we think about feeder cattle, we want the cattle that are going to gain the best and create the most profitable closeout. So from a purchasing standpoint, it's really risk mitigation. And knowing what we know about the genetic propensity, we've got some pretty decent models that can say, as a group, these animals are going to be high risk or low risk. And what we don't know is how many are going to qualify when we go test in large populations of cattle. Heterosis is going to be a big key to that. The cattle that we expect to be low risk are probably going to have some heterosis. And whether that's low risk populations being crossed or the heterosis syndrome itself is actually helping that risk level. But I think it takes a lot of testing, a lot of feeder calves to really know the answer to that. Whether they receive premiums or receive discounts in today's market, that's kind of hard to say. They're all worth an awful lot. So I think it's a really risk mitigation strategy.
What we see in our operation, and just to be honest with you, if we keep track of every ranch set of cattle, and we try and keep them identified in the feed yard too, and feed them as groups, so we know, what we paid for and what we get back. And if we have trouble with the ranch, they're going to get a discount because we're not going to bid next year. So that's the only recourse we really have,
So yeah, the Heart Healthy program, it's tough to put a dollar amount on it, but it's worth a lot. A lot of my friends that are, from Nebraska down to the Panhandle, it's something we all talk about on the feed yard side. This heart issue is a major, major issue. So yeah, it's worth a lot.
I think it's worth noting that the Heart Healthy program wasn't something that Neogen or Simplot dreamed up, right? It actually came through this pull-through that I'm talking about, in which feedlots came to Superior and said, we need a way to identify low-risk cattle. Superior came to Neogen and said, can you help us? And we went to Simplot and said, let's make sure that we get the right number of cattle that have to be tested in the population to accurately describe them, because we don't want to put forth cattle that have risk if we brand them that they're low risk cattle, that they aren't going to have those problems. So I think that in true fashion, that feeding up and down the system to be able to have pull through that risk mitigation tool that we have available was brought forth because there was demand from the folks that were buying cattle. They needed help identifying those cattle that had lower risk, and anytime we can decrease the risk of cattle you're buying, we can increase potentially the premiums that can be paid.
So would it be fair, first off, thanks for taking time out of all your busy schedules and being here with us and helping us be proactive, but is it fair that my producer that I'm representing these cattle for and I'm selling them to anyone, Poky feeders, for example, am I getting a call back, or is it fair for you to call me as the rep if you're buying them for yourself? It's probably fair to say David Ballou knows where 90% of his cattle, where he procured them from and where they're at, and obviously where he's feeding them as well as I do myself. But does my producer know that this is happening within his herd? Or is it feasible for you to be able to call me as a rep, and then I can look at that lot number and go back to that producer?
Yeah, we easily could. We don't currently, but yeah, it wouldn't be a problem at all.
I think what Bailey's asking is, have we taken like yearling cattle from 150 or 60 days to 180 or 90 days, trying to get more grade out of the cattle, and is it affecting?
Yeah, it does. In reality, death loss is 0.10% every week you got them on feed. So you feed them another 2 weeks, you got another risk of a 0.2% death loss. So yeah, if that answers your question.
But the industry is feeding longer, Bailey. There's no doubt about it.
I'd say on average 30 days.
Yeah. Poky's not feeding him quite that long. I can't stand good prices. I want to sell them as quick as we can. But yeah, we're not pushing them quite, but I know the industry has went a lot farther than we have in days.
And that'd be why you can't get in Poky feeders. Little guy like me, it's pretty hard to do. They are jam-packed and full. It's great customer service. They do a heck of a job. Any other questions?
So if we get our herd numbers built back up again, do you see the packer, all of a sudden, these bigger carcasses becoming a problem where they aren't today because we're short enough on numbers? Is that target going to move again?
Well, I think we've all, through our whole career, you know, and you guys know I've done it for a long, long time. You know, we all heard that the cattle were too big, they were breaking the rail, they were dragging the floor, you know, we were discounted, you couldn't, you know, too big, I can't bid, and we've all found that was a fallacy. But I think the packers, from my relationship with them, they have found that the plant utilization is so much better with these bigger carcasses. Their throughput is so much better, and it gets their kill costs down. So I don't see, if you look at the, you know, hog industry's done the very same thing. We've raised the pigs, you know, years ago, you know, 230 above, you got a discount. Now our hogs from Poky, you know, we average around 290. So, you know, the whole industry have changed in that regard. And I don't see the packer changing that. I really don't. They've just learned that it just makes so much more money for them having a bigger carcass hanging on that same hook.
Grant, in 2 weeks, I'll have the perfect cross for you. It's a Charolais Jersey Holstein cross, so you shouldn't have any trouble with them.
That's too
I'll
much
be calling
Jersey.
you.
Yeah, it's too much Jersey.
Really, that's a pretty legitimate question. We're seeing a whole lot more calf feds and the crossbred cattle, British with Holstein. Has it been? How's the heart health been on the dairy cross cattle?
It's been good. Yeah, we don't see the prevalence like we do in just straight Angus cattle.
Couldn't hear you back here. We couldn't hear you back here.
Did you hear the question?
Yes.
Okay.
I said
He said that hadn't been a problem.
we don't see the prevalence in the Holstein cross cattle like we do in the straight bred Angus cattle.
Our experience is it's highly dependent on sire. So we can see a similar risk prevalence in the dairy cross cattle depending on sire. Some better, some worse. The Holstein straight bred calves in our hands have been relatively low risk. And I don't know anybody's feeding straight Jerseys, but the Jersey cross calves can be high, can be low depending on sire.
Which sires on the Jerseys? Have they been using Angus sires? Has it been a stabilizer or a crossbred?
It could be, it's really agnostic to breed. We're seeing high risk bulls in every breed and low risk bulls in every breed. So it's, when you look at the profile of animals in the packing plant, the big picture profile, and we've scored, I myself have probably scored somewhere around 100,000 hearts standing at the packing plant, and our team a little over 130,000. We see a prevalence of heart score 4s and 5s in black-hided cattle that run about 4.5% to 5%. In our smoky type calves, so Charolais crosses, it's 1.8. Straight Holsteins, it's 1.2. So it just there's a big picture prevalence, but when you start drilling down to sires, there's high risk sires and lower sires in every breed we've looked at.
How many dairy cross or Holstein cattle is Simplot feeding? I mean, what's the test like is what I'm getting at, the accuracy.
So our feeding population is about 80% dairy cross calves today. We have 30,000 native ranch calves that come off our own ranches, and we ship a lot of semen to dairymen every week that come back to us as contracted day-old calves. So the test population itself is made up of all kinds of breeds. It's got Charolais, Limousin, Hereford, Simmental, Gelbvieh, Holstein, Jersey. What am I missing, Paige? Angus, Red Angus, some Brangus, some Santa Gertrudis. It's got lots of cattle.
Thank you.
Lots of different breeds.
Tanner.
Randall, we got a question from Allie. Question is, I see some Brahman and Brahman cross cows out with Angus cows and Charolais calves south of Bruno. Is this a crossbreeding experiment for heart health?
So I'm guessing those are probably owned by Grand Joe's friends south of Bruno. So, yeah, I don't know what the root of that question is, but we did have some inclination to think that our eared cattle, the Indicus type cattle, would lower the risk. That's not necessarily true. So as we've tested some of those crossbred populations, some of those are as high risk as, like I said, it's been interesting to see a high-end risk profile in every breed cross that we've looked at, including some of the Indicus breeds and breed crosses.
Early signs. They would like to know or she would like to know the early signs of BCHF.
So the earliest sign we see is increased respiratory effort and increased exercise intolerance. Those are the first two things we see. The classic brisket swelling and submandibular swelling, we see those, but rarely. Most often we're seeing things like they just don't want to move, even in baby calves. Some of the baby calves will look like a respiratory syndrome and often get treated as pneumonias. And those spots where we've had really high incidence of cardiac failure in baby calves, they look a lot like a pneumonia in a baby calf. In a feeder steer, it's just they stand with their feet apart, elbows abducted, and they struggle to breathe and don't want to move. Would you guys see the same thing at your place?
Exact same thing. Yep.
They're just trying to get air. They're doing everything they can to get more air intake.
We know the outliers are out there in every breed. We just have to do enough testing to find them. I mean, even within our small population, generally, when you think about Angus cattle across the U.S., our population's small. In our population, there's outliers in that. So we know they're out there in the country. We just have to find them.
Question was, how many generations do we have to get away from that high-risk animal in order to be able to change that risk factor? I'm asking that because I want you to answer it, Dr. Raymond.
Want me to answer? It depends on how aggressive you are in selecting for that particular trait. So if you can find animals that are in the most favorable 5% and use them over multiple generations, we can probably turn this around in 1 or 2 calf crops. So we can. Let me give you a little context. So we run a 3-breed crossbreeding program. We run Angus and Hereford females, and we try and make a really moderate female to fit our desert operations, and we use Charolais terminal sires. When we use low-risk Charolais bulls on a Hereford Angus cross cow, we can change the feed yard risk overnight. We can go from 5% to less than 2 overnight in terms of heart score 4s and 5s. To do that in a breeding population where we're not talking about terminal crosses, I think it all depends on how aggressive you are in selecting sires and how aggressive you are in selecting dams, and can you find them. So I told you a few minutes ago, we breed 4,500 heifers a year, AI, sexed heifer semen. I struggle to find a single bull in the major semen studs today that is low risk for heart failure at a level that will actually move the needle. They're not being purchased and promoted in that channel today. We found them. We own some. We collect our own semen on some. But it is a challenge. So it's really a function of where can you find the cattle? Can you find them in the lowest portion of the population? How aggressive do you want to be? If we select for cattle and do it around the middle, it's going to take us a long time. So I think the key is, what is your appetite for crossbreeding? Can you find populations that cross well, that can make you the right terminal calves? That's our strategy. Use low-risk Charolais bulls. We can change the feeder population overnight. On the female side, that doesn't fit our model. We're using animals that are English type, and so we've got to be picky about, and that's why we genotyped all our heifers, because I think it's going to take both sides of that equation to move the needle. And we've never done that before. We've always thought we sort our heifers, cowboys sort them, we pick the phenotypes we like, we want the breed cross that we think is most favorable, maximize heterosis. But we made a commitment this year, and I don't see it changing in the next 5 in using that as one of the tools to select our females.
Ranchers are pretty wise, and those that have been in it for a long time, always looking for balanced traits, not extreme one way or the other. This is one more great tool to incorporate in their bull selection or female selection going forward. Anybody else got a question? Because we're going to wrap things up. We've got a big day. Well, we certainly appreciate all you making time to be here with us this afternoon.